Welcome, everyone, to the fourth session of our ISBCAN's HUDDLE. It's our newest multidisciplinary Grand Rounds training concept in child protection. The HUDDLE was born out of an idea that this work is often isolating and lonely and very difficult to deal with. And so we thought that this would be a great way for us to bring together people from different sectors to come together and understand what the current challenges are around different types of cases of child abuse and come up with some innovative, interesting solutions that would work across the globe. Doing this 360-degree case analysis allows us to come up, think about things objectively without blame or bias, and identify gaps and opportunities for improvement. We really want to encourage you today to think differently and think about what is happening in your region, the challenges that you face, and how we might innovate and come up with new solutions. Mandela said it beautifully. No one gets it right the first time, and often we have to pick ourselves up, try again, and innovate and continue to improve on what we're doing. This huddle concept that ISBCAN is launching will take a different case every year so that we can dive deeply into the multi-sectoral approach. In year one, we're taking a case of child sexual abuse and doing it virtually. In year two, we hope to bring this same case of child sexual abuse into the regions and deliver this in person, where we can adapt it to various cultural elements and language and make it more relevant to each of you in your regions. In year three, we're thinking about doing a case of online abuse and bullying. And so with each iteration of the huddle, we hope to continue to bring relevant cases to all of you around the world. None of this happens without a great group of people. This concept and the development of the curriculum happened with a great group of people who came together and imagined this in a way that we could bring more relevant training to practitioners around the world. So a big thank you to all of these people who contributed in different ways. And I'd really like to call out our special partners at the Harub Institute who helped us formulate this entire thing, as well as the Kemp Center and the Zoma Foundation who are working on evaluating the huddle. As we think about this work in child protection, we really want the objectives of this huddle to marry up with the things that we think we can improve on. We want to understand what the global challenges are that face child protection workers in the current day. We want to learn what the best practices are and share those with all of you. And we would like all of you to really think honestly about how we can do better. We want to enhance this multidisciplinary collaboration, update knowledge and skills for everyone across the globe, and most importantly, build a professional network so that we can collaborate and really build bridges across sectors and across the world. In year one, we took this case of child sexual abuse as it was told through the eyes of the child in the movie Rewind. This documentary allowed all of us to look at this case objectively from the eyes of Sasha Joseph Newlinger, who was the child survivor and who was brave enough to make this film, piecing together his home movies and putting together his story to understand what happened to him and what the family dynamics were, as well as what the multidisciplinary response was that helped him to overcome and develop skills of resilience. So we thank Sasha for his efforts and his nonprofit Voice for the Kids that supported this work. In the following sessions, we wanted to break down the case in a way that would be useful for all of you to also think about. In the second session, we worked on identification. In the third session, we talked about assessment and medical from the social work and medical perspective. Today's session will focus on the multidisciplinary response. And next week, in our final session, we will be talking about mental health, follow-up, and building skills and resilience. The first session really challenged us to all think about what were the current challenges we faced in child protection services. We know these systems are under-resourced, they have inconsistent standards across regions and countries. They're often faced with racial and socioeconomic disparities. And in this case, we see how intergenerational trauma from parents to children is continued. So we need to think about how we can improve on all of these factors. In the second session, we focused on identification and disclosure, some of the barriers we often see, why CSA goes underreported, what the stigma and shame challenges are, how certain communities have even more challenges when you have children with disabilities and other types of high-risk communities. How can we do better? We really wanted to challenge people to think around the world about what we could do to improve on identification and disclosure challenges, to address the shame and to come forward with their abuse. We also introduced the public health model and why it was so important to coordinate across disciplines and sectors, having a proactive, prevention focused attitude from universal services administered by the government, as well as from the bottom up, community based and population wide strategies that would help us to identify early children that were at risk and instill some prevention into the work. In last week's third session, we talked about assessment and the key reason why we need to take a trauma-informed approach so that we are always focused on being child-centered. The assessments have to be asking the right questions, restoring the child's sense of control, and creating a safe and appropriate space for them to explain and disclose what happened to them, as well as undergo the medical evaluation. So that session really outlined what a good assessment really entails. It's not a checklist, it's not going to look the same in every situation, and that the assessment really needs to be led by the child, developmentally appropriate and emotionally safe, so that the child can really tell their story and feel and not re-traumatize them again. Another key piece of this is that an effective assessment really depends on collaboration across systems. And today, our experts are going to talk more about this and how to do this. Medical evaluations also need to be trauma informed. And Denise covered last week on how the medical assessment also needs to be led by the child, be holistic and meaningful. So, not just a physical examination, but also understanding the behavioral indicators that a child might be expressing that would allow us to have an idea of what has happened to them. If you want more information or would like to go back and listen to these sessions, we really encourage that so that you can get a deeper understanding of what we covered. But the assessments, again, in order to make them effective and protect children, we have to make sure that that professionals come together across systems, understand the cultural barriers that might exist, and standardize protocols, make sure our professionals are trained in order to handle children the right way, and encourage the child's voice, having an open dialogue with the child and the family in order to really understand what happened to them. So effective multidisciplinary collaboration really does require that everyone has a clear role, has mutual respect, and have a reflective practice so that we can have collective responsibility around what happens and the outcomes for the child. So with that introduction, I really would like to now move on to introducing the experts for session 4, where we are going to be now digging into the multidisciplinary response. So today's curriculum, we're going to have the presentation by the experts, followed by a small group breakout rooms where we will have a deep dive and discussion. And we really would like you all to participate openly, knowing that those sessions are not recorded, but we would really like honest reflection of the things that we are each seeing in our culture, in our communities, and countries where the challenges are truly, need to be addressed. So please be open with your comments and thoughts in those sessions. Then we will have a Q&A session with our leaders, and talk about some final best outcomes for children and families. And before I introduce them, just the last thing to say is that next week will be our final huddle session, and we will be having Sasha as well as Pablo joining us so that we can focus on mental health and long-term resilience to understand what really helped Sasha to make his abuse only the first chapter in his life, as he says, and he moved on to um, be able to have a very productive life with the right help. So we will cover all of that next week. So this week, we will be focusing on the multidisciplinary response, and it is my pleasure to introduce our experts today. First, we have with us Diane Gordon Harrison, who is a lawyer and ombudsperson for Jamaica. She serves as the children's advocate since January of 2012 and is also Jamaica's first national rapporteur on trafficking. So we welcome Diane, who is also on the board of ISPCAN, here with us today. Also with us from Brazil, we have Sydney Filho, who is a professor of psychology at the Universidade de, I'm not going to say this correctly, Tuti de Parana, but Sydney is a wonderful ISPCAN member and professor in psychology. And then finally, we have Abby Newman, who is a lawyer and nurse and is also on the Distinguished Advisory Board for ISPCAN. She is one of the CEOs of Mission Kids Child Advocacy Center in Pennsylvania. And it is my pleasure to turn it over to Abby. And thank you all for your expertise today.
Thank you, Pragathi, for that introduction, and thank you everybody who's joined us today from all over the world. I've been watching some of the messages come in and the participants, and we all really appreciate your being here with us today. As Pragathi said, I'm the CEO of External and Global Affairs at Mission Kids Child Advocacy Center. I'm also their founding executive director, and the reason that that's pertinent for this discussion is that Mission Kids is and was the child advocacy center that was formed specifically as a result of the trauma that Sasha and his sister went through. And you saw it a little bit at the end of the film. There's a small tour of one of our prior locations, and we'll get into how that collaborative response formed and from nothing. And how I hope the takeaway from everybody here, along with others, is that this is something, if we can start it, so can you, regardless of where in the world you are. Okay, next slide. My associate Sarah is driving the slides today, so you might be hearing some next slides, but hopefully it will run very smoothly. I'm sure that it will. So prior to there being a Mission Kids and a child advocacy center in Montgomery County, Pennsylvania, we're located in the United States. We sit right outside of Philadelphia on the east coast of the United States. We're a county of about 800,000 people, so we're not small by any means. But prior to Mission Kids opening in 2009, what would happen is that there were an average of 11 interviews per children once there was a disclosure of child abuse. And as Pragathi was talking about, these interviews were anything but trauma informed. And every time, we all know, the child is re-interviewed and has to tell their story again, they are being re-traumatized by having to relive the experience. And the locations of these interviews would often take place in police stations or prosecutor's offices where, more than anything, the individual is not trying to re-traumatize Sasha or any other child, would probably conduct a cross-examination to make sure that they were getting what they thought they needed for trial, but not, or an investigation, and not necessarily thinking about the impact on the child each time. Also, that would result in some differing statements because a child might use slightly different words, and we all know that when we take notes or we write about something, that we might take it down slightly differently. When I did practice law full time, I was a trial attorney, and I can tell you that to this day, I can take two separate statements that were written by people, everybody attempting to be honest, and make somebody sound like they're lying or not telling the truth or just don't remember what happened. So that's traumatizing to the child in its own and unique and special way. And of course, when everybody works in silos, there are fewer referrals for specialized medical care and mental health care, which is something that we now understand is just so important for each and every child victim. Next slide. Next slide, please. Oh, there we go. Oh, back again. Sorry, I apologize. I missed it. So we know that collaboration is the key to supporting child victims. And that's what we all strive to do and what we all need to do in our communities. And clearly, what did not happen for Sasha and his sister, and why they had such a horrific time, and why they were being re traumatized by the system to the point that their mother said, "What happened to my children is horrible. Your system is worse." Coming from a mother, that is certainly a statement indeed. So, how do we get to this collaboration between the professionals from all of these different disciplines? Slide. Obviously, you have to get the right buy-in from the people who you want to be involved. So sorry. Excuse me. Buy-in from the right people involved. So that means getting the right people on board. Who are the right people? Not only from the disciplines, but you have to get the right people who are willing to understand that there's a better way to do things, who are willing to leave their egos at the door once they come in and start to collaborate. They have to be people that are willing to have meetings, that are willing to have open, honest, and respectful discussions, even if they are passionate in what they believe to get to the right result. And those discussions, people have to be able to compromise and have more discussions and then compromise some more. And that's how you get buy-in. Diane, do you want to jump in and talk a little bit about what happens in Jamaica?
Yes. Yes, certainly. Thanks, Abby. So that's so important. And I'll pick up right where you left off about leaving egos at the door and having those honest conversations, because it's very, very likely, and it's very much the habit, certainly within the Jamaican context, that every partner and stakeholder comes to the table saying what they do best and why the issue perhaps falls on somebody else. And so, because we had what I'd call a come to Jesus moment in Jamaica, where many children who were victims spoke about the re-traumatization of the system and the need to discontinue their seeking for justice because of just how difficult it was for them to cope, we had to really run a test case. And so this came about without any legislation, without any kind of broad national policy, but just a decision to see if we could have a multi-sectoral kind of involvement that saw us doing things differently. And so while we already had a sexual offenses for the investigation of sexual offenses and child abuse, which is really a specialized arm of our police force, we decided to move it outside of the traditional structure in terms of a police building. And so there was a house that was converted, that was now the base of this particular center, the special arm of the police force. And in that house, we also now had a medical doctor who was adopted as a member of the police force, who would do the physical examinations right there on spot. We also had the Victim Services Division, which is a division of our Ministry of Justice that focuses on ensuring that victims of abuse, particularly child victims, are given the psychosocial intervention that they need right away. And so the information that is being given when the police officer, who is also stationed at this house, is collecting details from the child, that is used to inform the psychosocial intervention. And so this model really was based at one single center, nowhere else in the island. And then it started to gain some amount of traction because persons saw that this was now reducing the number of complaints that children and their parents were coming forward with. And it was allowing us to hold on to the victims a lot longer, with a view now for the long game, which was to ultimately hold the perpetrator accountable. So that was a test case, which has now become the norm. And there are more centers across the country now that have this multi-sectoral build out, so that we can, as you say, have the meetings, have ongoing discussions, and have the collaboration, because that's what actually drives change. And that's what helps, we think, to minimize the trauma to victims.
Amazing. Sydney, how about in Latin America? What do you say?
So many times in Latin America, what we see is that there's a lot of discussions, but there's not a lot of compromise on the next steps. So next slide, please, Sarah. So one of the things that we we usually try to do in those meetings is to try to create a team. But many times those teams, they should have difference according to the local culture and law. So in Brazil, we do not have only pediatricians. Pediatricians are like a commodity in Latin America. They are very hard to find pediatricians. And we discussed it in our previous meetings with Abby and Diane, how hard it is to find a pediatrician that is a specialized child sexual abuse professional in Latin America. So one of the changes that we had is that general practitioners in Brazil, they also have training about child abuse and child sexual abuse. So many times what you need in your country is to understand who could be that professional that could compromise with this strategy. And many times when you're looking for a really specialized professional, you're not going to find that person in your community, in your society. So the idea to discuss and compromise many times involves bringing people that you were not expecting at first in Latin America, but that they can be important actors into child protection agencies and child protection in general. So many times what we have is those systems being built as it is something we usually say in Latin America, they are fixing the car as the car goes. So we're always doing that in Latin America. And many times you have to choose between different strategies to reach those professionals.
Sorry, Abby, if I could just follow up very quickly on what Sydney just said about fixing the car as the car is moving. It brought back to mind, certainly within the Jamaican context, that that too is very true for our situation. Because even as we had a medical doctor, as I said, based at the center, there were still discussions about when to examine, if there's resistance from the child, what wins? Is it the need for the evidence to be collected for the prosecution, or is it the child's right to the autonomy over her body, or just the discomfort that they were feeling because they hadn't received enough counseling yet from victim services? So even though the test model was up and running, there were so many glitches that still needed to be ironed out for all the kinks to be straight so that it could function seamlessly. So I just wanted to add that from the Jamaican perspective as
Yeah,
well.
I think that those are really good points. And I think that it's worthwhile pointing out that when there's any new system and any new multidisciplinary response team, that's going to happen. You're going to have to work the kinks out because what sounds good on paper and sounds good in theory and ideas, once you hit the ground with it, maybe it works and maybe it needs to be adapted and you need to get a different kind of gas in your car or something like that. I'm not really good with car analogies, so I'll probably stop there. But that's a good segue to talk about the next slide and MOUs and memorandums of understanding. So Sydney, if you want to jump in on that.
And this is another very Latin, and as we were discussing with Abby and Diane, is something that seems to be global. That there's a lot of relationships that are personal relationships. So you have a social worker that knows someone's in the law system, and they are talking about personal relationships. And if one of those people are on vacation, they have a sick day, everything stops. So the idea that we have memorandums is important to bring those relationships to the institutions and the services and agencies that are working toward child protection. This is something that we saw in Brazil that led to higher integration, but also it really diminishes the complaints about the system because it creates real expectation. It diminishes the expectations about changing happening right away, and it helps a lot the exchange of critical information. So if you know your role in that system, you know you don't have to do everything. You know exactly where you should supposed to work with that family, and you know who you should call to bring that action together to protect those children. So one thing that we're trying to move forward in Brazil is to actually move from those personal relationships to institutional relationships and create these bonds among the services because the institutional will keep going. We're going to retire at some point. We may want to take a sabbatical at some point, and those things are going to stop the system if we keep doing them in personal relationships. And this is something that we do because we know, and maybe you are the focal point of one of those services, and people are going, oh, you have to talk with Abby. Abby is the one that is going to solve this for you. But when you do that, Abby is going to be overwhelmed, and the exchange of information is going to be stopped because Abby can handle a certain amount of cases. So this is one of the key points for us in Brazil right now, moving from those personal relationships to institutional relationships.
I think that that's a great idea, and it gives everybody something to stand on in terms of what they're doing and why they're doing it. It's written, and it's real sustainability for whatever it is that you're creating. It puts it beyond the person, which is exactly what it needs to be, Sydney. Excellent points. All right. Slide.
Right.
Okay,
So,
yeah.
yeah, so back to the Jamaican context, and I think a very good follow-on to what Sydney just proposed is that we too, like Brazil, and I think other jurisdictions across the world, can truly say that sometimes a child's experience with the system or the contact that that child has with the system is determined by who just happens to be on duty or who just happens to be handling the case. So we recognize, certainly within our low and middle income country experience, that systems were not as robust and consistent in terms of standards. And if you happen to get a great police officer, you would have a great experience as a child. But a child who had a very similar set of circumstances and violation could have the complete opposite reality if they got a police officer who was not sensitive to the issue and who did not have a great disposition. And so because we are within that low middle income environment, which has differences in terms of standards and professional responses, and we're also mindful that our environment is one where legislation and regulations are very slow to pass. So our legislative calendar is very much backlogged. And so that affects how quickly regulations can be made to streamline different processes. And so what has been happening is some amount of self-help, if you will, whereby different stakeholders who have to deal with CSA have decided to craft memoranda of understanding or standard operating procedures or cooperation agreements as between different government entities, for example, to help things to chug along a lot more smoothly and to transition from that personal response to an institutional response. So, for example, when we think of CSA within the Jamaican context, some of the stakeholders would be the specialized arm of the constabulary force that deals with sexual offenses and child abuse. Then we would have the Ministry of Justice with the Victim Services Division providing the psychosocial support. Then we would have an executive agency which falls under the Ministry of Education that deals with therapeutic care for children. And then, of course, we also have the medical practitioners who deal with the examination. And then at the greater level now, if there are any child rights issues at play that are identifiable, you also have the Office of the Children's Advocate. So what has happened is that there has been a memorandum of understanding which now underpins that multi-sectoral model that I discussed earlier when I was speaking, where we have all of these entities in a house, which really is a police facility, but there is a working memorandum of understanding that says exactly what each player is responsible for and what each player is expected to do and when those players are expected to do it. Outside of those core groups, there are also standard operating procedures that would extend to other entities. For example, the school that the child who is the victim would have attended, so that if there's a guidance counselor within that school, they know what they have to do as well to support the child from that end. So these really are useful tools in our context that are used by Government of Jamaica entities among themselves, and at other times when the need demands it, with non-government actors. So depending on the nature of the problem and the community, some of these non-government actors would, for example, have an agreement with the Government of Jamaica entities and the church because in Jamaica, there are many churches that operate different, what I would call facilities or support services that they provide not only for their members, but for community citizens who have a need. Sometimes as well, we have our local university that's operating a program that focuses on, reparative kind of counseling or occupational therapy around a particular issue. And sometimes as well, it could be a civil society organization that deals with ongoing counseling support or play therapy. And so these arrangements, all in all, help to manage expectations, streamline responses, and improve service delivery to children in a number of different sectors. They also reduce the typical approach of working in silos, because many times as well, that is a challenge that we have in Jamaica, and I suspect in many jurisdictions, where each player comes to the table knowing their part very well, but not knowing how to interconnect. Another thing that I'd like to mention is that many of our services as well focus on having what we call a referral map. So, for example, the Office of the Children's Advocate now operates a child and teen helpline known as Safe Spot. And what we have as a part of our tools is a working referral map, which really maps all of the stakeholders and services across the country that give us that quick point person to refer things to if we see something coming up that requires that particular service's intervention. So we find that these are quite useful in helping to streamline the process and hopefully at the end of the day, improving the quality of services to children.
Okay, thank you. So another thing to do when you get everybody together is don't forget your community. So Diane, you mentioned that you had clergy involved as well and different members. So you need your team members, but don't forget your community because you're responding to child abuse and it really does take a village. So what we did at Mission Kids is that we formed our board of directors, our very first one. And so not only did we have the different multidisciplinary team members, but we also had community members. We needed to get in the US to have this done. We needed nonprofit status, which goes through the Internal Revenue Service here. And so we needed an accountant. We needed a lawyer that was not a criminal lawyer. We had somebody from the media and PR that could be able to help us get the word out about what we were doing. We also, to make ourselves more likely to get grant responses, to be able to fund, because funding is always an issue, we performed a needs assessment and a business plan so that we could get grant funding to show that this really was going to work. And we had, it's important, I think, to get at least one champion, somebody who's really connected in your community to help bring the community with you. In our case, it was the district attorney. You saw her in the film Rewind. She's now a judge, but she was very plugged into the community, very well respected. And so she was able to bring lots and lots of different segments on board to listen to what we wanted to create and we're going to create to help everybody and all the children in our community. Next slide, Sarah. Sydney.
So the idea for us is to have to provide a platform for everyone to have a voice. And many times what we see is a lot of professionals here in Latin America, and we saw that especially during the pandemic, thinking that what they have to say is not going to be relevant or is not going to be heard by anyone. So many times our meetings with professionals in Brazil, we have like 10 or 15 minutes to be a complaint meeting. So everyone's facing hurdles and barriers at child protection services, but we got to move towards a more problem solving and into more resolutive measures in those meetings. Because if we keep complaining, we can stay here all day just saying about all of the issues that we face while trying to protect children in our jobs. And the idea is that everyone is important. So you don't have just one key service, but everyone is important. So here in Brazil, what we have is education, especially professors and teachers are the most are the professionals that make the most number of reports of suspicious case of child abuse. In the healthcare services, you have the most common reporting of child sexual abuse. In the social work, you have the most reports of negligence. So you have every one of these key of those services are key to some form of child abuse. So everyone is important. And to provide a platform in those meetings is very important so we just don't keep complaining that we are not funded enough, that we do not have enough professionals, and that this job is hard because it is hard. But we gotta move forward with those meetings. And to include everyone is also important to have different opinions happening. So if you have one service that is considered or evaluated as more important, many times those different opinions about how that service could exchange information or how could help other services, it can be unheard in those meetings. So it is important that everyone has a voice in those spaces so we can try to think about those solutions together and not just keep focusing on what's wrong. Because many times we all know what's wrong in our different services. This is not something new to us, but we can try to talk with those other members and those other services to try to move towards contribution and impact to society.
Diane. Oh, your problem's unmuting, I see. There you go. There you go.
Yes. So I mentioned this before in my previous comments. And really, this gives the context as to what drove the model being instituted. And so, as I said then, fears about child victim re-traumatization at the hands of the system propelled the creation of a multi-agency model, first as a test case, a pilot, to see if it could even work. And then since then, it has been working and that model has been maintained. And so that saw a less rigid physical environment. And so law enforcement, the specialized arm, Center for the Investigation of Sexual Offenses and Child Abuse, was set up in a converted house to deal with sexual offenses. And also this saw the membership and partnership now of the Victim Services Division doing counseling on the spot, representatives from Children's Services, as well as a medical doctor who was now permanently assigned to Sisoko to prevent multiple visits to various locations. What's also interesting and has kind of come with time as the evolution has continued is that the medical doctor is now a superintendent of police because they wanted to institutionalize the position as a part of the permanent team of Sisoko, because the idea is that let it not be that a different commissioner of police, for example, takes the reins and says, okay, we want to dismantle what's happening here because this is not how we're accustomed to doing it. So there is now an institutionalized position for a superintendent of police who must be a registered medical practitioner who is trained and sensitized to doing child evaluations, particularly where the allegations surround sexual offenses and some form of exploitation, which I think is a great development because it means that we're truly trying to transition that personal model approach to what will be an institutionalized approach. What's also very useful as well is not only is the environment less rigid in terms of a house, but we have now, through a partnership, funny enough, with the US government over a period of 5 years, we've started transforming a number of these interview rooms into child-friendly spaces where there's a lot of focus now on scenes of nature and calming white noise and sounds of the river and all of these things to help relax children, with some input from psychologists as to what colors, for example, in the paint are more, amenable to creating that kind of calming environment so that the child can feel a little bit more relaxed when speaking about what clearly had to be a very traumatic incident. And so I think that we're moving towards normalizing this kind of approach, so that it becomes, as I said, not just who you get today, but the system responding in a way that is quite more trauma informed than it previously was.
That's amazing how it keeps developing. No, that's exactly it, Sarah. Next slide. That's exactly it. And that shows, I think, that you're adapting and you're changing, which is exactly the point at the beginning when you're describing it as, making the car as you're driving it. But the
Yes.
same thing happened with us. Exactly. The model outcome and the opportunities that developed as a result. And I swear I silenced my phone. I don't know why I just did that again. I'm very sorry. I'm technology. Um, so with Mission Kids, we were sure that after 5 years of being up and running, that we were going to be seeing 250 to 300 new children per year at our center. Well, we now do and interview 600 children per year on average. And since we've opened in 2009, we've seen over 8,000 children at our center for allegations of child abuse, many of them for child sexual abuse. And that just proves that nothing succeeds like success. The more you do, the more institutionalized it becomes, the less personal it becomes, the more sustainable, the more people are bought in. It's like one big happy feedback loop. Next slide. So with that, of course, there are challenges and lessons along the way that everybody has to look at and learn. Changing systems is hard. And I think that's what Diane and Sydney and I have each been talking about during this presentation is changing systems. And it involves changing habits that going back to personal. First, you have to change the habits of the people in charge so that it can become institutional, and then it just becomes part of the system. You have to change the mindset of those people that are in charge. But again, nothing succeeds like success. And once they start seeing that the model works, however it's developing in your community, the more they will be bought in, the more they will want to do more change. Enforcing those regular meetings and communications and funding foreign training for these specialized mental health providers, victim advocates, and other services. And the other thing that I found as a tip is that directors from like organizations, whether they be in your community or international, like we're all having today, are very happy to help. If anybody wants to reach out to me, for instance, afterwards, and I always speak and go out on a limb for both Diane and Sydney, I'm sure they too would be thrilled to help and support anything that you want to do in your community. Next slide, please, Sarah.
So
Okay.
lack of financial resources, as Abby was saying, is something that is global into child protection. I don't think there's any professional for any country that says, oh no, we're adequately funded on this one.
No.
Maybe in low and middle income countries, this is an issue that is more prevalent or more highlighted in our practices. And also, when we think about the lack of financial resources, many times we're thinking about the lack of support or trust in the law enforcement, the law system, or the government for this lack of funding. And what we actually trying to do in Latin America and low and middle income countries is baby steps. Were just able to increase the training of law enforcement in our state from 2 to 4 hours into their training. It's not a lot, but it's double the time they used to have for child abuse. So many times what we're trying to increasing those collaborative responses is to raise awareness and use the financial and support that we have right away. As Diane and Abby were saying, those agencies work in silos. Many times what they do is that they don't know the scope of the problem because many times the law enforcement, they just are acting upon the emergency calls. So they don't know how the full system works. So they don't track the cases. They just report to the child protection services in Brazil, and they don't never heard about that again unless they are called up again. So what we're trying to increase here is this collaborative response that involves awareness of every agency using the financial resources that we have available. So many times what we're trying to do is to show and convince and sell this idea that it is important to use the financial resource that you have available to child protection because it has a ripple effect towards this child as it is growing up in its development, but also in the whole society. So many times when we're trying to see the improvements, and I say this to Abby, if we in a low and middle income country go visit mission kids, it's going to be very far away from what we're trying to build. But Abby started somewhere. So this what Diane has been doing in Jamaica as well. So if your country does not have that, it seems like far-fetched, it seems very utopian on our side. But every one of those professionals started somewhere. So in Brazil right now, our big concern is training. So we're trying to increase training for all law enforcement, legal system, judges, prosecution, everyone, everywhere. So many times you have to understand with with whom you should collaborate and which under circumstances you should actually raise awareness, or many times you should actually engage in training with those professionals.
Thank you. Next slide. Sydney, do you want
And
to talk about, yeah, they're
yeah,
utilizing these regional and national NGOs.
so we try to use a lot of different resources, and especially right now that YouTube has the translation option for your local language, and it has for Brazilian Portuguese and Spanish that are the most spoken languages in Latin America. So engaging in those networks can be very helpful because for a lot of our professionals, to watch a class by Diane or Abby or any of the other professionals that we have here in the huddle is something that is not very common. So to actually engage with those professionals is very important. And we've been trying to build those communities as well and to create those communities in our region and language. So what we're trying to do is actually to move just from the academic side as I'm a professor, but to actually engage those different collaboration networks using NGOs or the government itself. So we've been trying to build those communities so they have access to the best knowledge available, but that they don't have to know the most up-to-date Bayesian statistics because they don't have time to learn that. Even we struggle with that kind of statistics. So what we're trying to build around here is not just so people can collaborate with each other, but that they can have access to the most updated knowledge in a way that they can actually understand and apply that knowledge to their reality.
Thank you. And I think that with the next slide, that illustrates exactly what you were just saying, Sydney. Sarah, if you can go to this website and let me explain to everybody what we're talking about here. This is a link to ISPCAN's Collaborative Response Framework. And this is an ISPCAN project. I was really proud to be chairing a global steering committee, of which Diane was an important member, and other people. And that steering committee is there. It was a global steering committee to come up with how do lower and middle income regions that don't have these financial resources be able to develop a collaborative response to child sexual abuse, like you might find at a child advocacy center in the United States, perhaps ours or others. So on the website, it lists the steering committee. It goes through all types of background on it. It also goes through, if you can click on the template, it's a fillable response, Sarah, on the right side. Right, so there's the narrative that tells you how to put together your team. And then there's a fillable form to make it very easy if you're trying to start a collaborative response in your community for suggestions of who you might want to look at in your community that would be the right people for buy-in, as we've been talking about, to put in the room and have these discussions. And this form just is an easy way to help you keep track of your list. You can put in the professional, their discipline, their contact information. So it's easy for you to see where you may have gaps and more challenges, or where you see really that you have strengths, which is where this framework was developed from a position of strength, because we are truly believers that there are resources that everybody has in your community that you're able to apply to put together a collaborative response. We came up with 12 steps that are outlined on this page, and it's ready to go for you. And I will put myself out there again, and I'm going to put Pragati out there because I know that she would welcome, and Diane and any of the other steering committee members. If you want thoughts or help with how we might be able to help you put this together, let us know. It is being piloted currently, Afnan Adarish Najir, who is one of the facilitators on the call today, is taking the really bold step of bringing her community together in Arab Israel and is piloting this even as we speak. And I'm so proud of her and what her community is doing in terms of taking this next step. So please let us know how we can help you in this regard, because we really know that you can succeed and want to see you succeed. Okay. Sarah, next slide. See that we're running up on time here. We want you to dream big. All right, we really do. Mission Kids started in a very small donated space. There we go. In a very small donated space. But think about what your vision is for your future. We're now in a space that's 3 times the size of what we started in 2009. We just purchased our first building that's going to have a training center attached to it for responders to child abuse specifically. And we'd love to have you at some point be able to come up and train there. And hopefully we'll be able to provide virtual trainings as well from there. And this way we can all together and you can break the cycle of abuse, both currently in the ripple effects that you have in the current generation for that child and the family and their extended family and community, but also intergenerational, like we saw in Rewind, so that we can actually, Pragati was speaking at the beginning, I think before we got on, about a new project to go to 0 child abuse, which is all that we want. And last point on this, Sydney, do you want to talk about helping fathers and engaging the whole family?
And using the movie as a background here is something that Professor Christine Weckerly has been saying for quite some time about the importance of engaging fathers and boys in child protection as well, because many times those boys are going to be fathers in the future and they're going to have the important role of protecting their children. And this is something that we usually see in Latin America. Not only the mother is many times responsible for the child protection, it creates another burden for those mothers. So engaging the whole family is something that is very important in those services. Many times they are very oriented towards the mother, and it actually, the mother has to work, she has to take care of her children, she has to protect them, she has to go to the services, and the fathers are not responsible for much in that sense. Many times they are the perpetrators, and this is something that creates another barrier, but they have to be involved in child protection services. Not only because of the burden that this creates towards mothers, but because they are part of the family as well. So we can see that in the movie with Sasha's father talking about his abuse and the lack of protection that he went through towards his life, but also the lack of support that he had while his children were abused. So this is something that we want to bring fathers more and more into those services, especially when they are not the aggressors.
Could not agree with you more. Those are excellent points, Sydney. Thank you. Before we go into the breakout group, we were asked to put together and show everybody here a very short video. It's 2 minutes about what Mission Kids has become. And we're showing it to you because, remember, Montgomery County started with nothing. It started because of Sasha's terrible trauma and his sister's trauma. And this is, if we can do it, you can do it. And that's what we wanted to show you. Sarah, can you show that video before we go to the breakout rooms? Thank you.
We are Mission Kids Child Advocacy Center. Every child, one mission. Achieving healing and justice for victims of child abuse in Montgomery County, Pennsylvania, and beyond. Child advocacy centers provide support to victims of child abuse. Without one, an abused child may have to tell their story over and over again in settings that can be scary, like hospitals, or where kids may think they're in trouble, like police stations. Then families have to search around for the services their children need to heal all on their own. From doctors to lawyers to therapy services, it's a lot to navigate alone. This is how child abuse cases were handled in Montgomery County before we opened our doors in 2009. Now, when a child experiences alleged abuse, the case is referred to Mission Kids for a forensic interview at our center. Here, a child can tell their story in a safe, child-friendly environment to a trained forensic interviewer who has questions that are designed to reduce re-traumatization. At the same time, representatives from our district attorney's office, law enforcement, and child protective services work together as a multidisciplinary team to observe the interview through a closed-circuit television. Our family advocates are present and proactive for the entire healing journey, from the day of the forensic interview to the end of the court process, and even after if needed. We provide support, referral services, court preparation, and so much more. Even though it's hard to talk about, child abuse happens, and it knows no borders. From developing a model response to trafficking to taking a lead on public policy change, our impact also knows no borders. Mission Kids partners with researchers across the globe to publish studies in peer-reviewed journals. We provide training and mentorship at the state, national, and international levels. When we go global, we impact local, and the sky is the limit to how far we'll go to protect our children.
Thank you. That concludes our portion of our webinar this morning. So Jane, I guess I turn it back over to you, right?
Yeah, Sarah, do you have my slide or no? So for everyone, now we have the opportunity, and it's a great, Diane and Sydney and Abby have given us such great information looking at 3 different regions of the world. And now you have the opportunity to meet with them, as well as members of the steering committee and members of our Haruv team in a small breakout room. So what will happen now is we have 3 breakout rooms. You will receive a prompt to join that room. We're asking that all attendees do in fact join a room. And in the breakout room, you have the ability to turn on your camera and your microphone and participate in the discussion. The first 3 minutes of the breakout room will be a Mentimeter poll run by our Haruv team. And they're just 4 short questions. The answers to that poll will not be shared till we return to the breakout room. It'll be an anonymous poll. It'll appear in a word cloud and kind of give us a great starting point post breakout. But those first 3 minutes will be in the breakout room, the poll. After that, we really ask that with your facilitators that you use this opportunity to talk about your regions, your situations, your challenges. We'd also like you to introduce yourself, and the facilitators can guide this. We want to know who you are and where you're joining from. And then you'll be returned to be in the breakout room for 40 minutes. You'll be returned to this main session automatically. And there are 4 questions that will be discussed in the breakout room, which were created by our 3 presenters today. And just please, I know Pragati mentioned earlier, please know the discussions are not recorded in the breakout room. And, it's a safe space to share challenges and hopefully successes as well in this area of collaboration. So
First one that jumps.
perfect. Sydney or Diane?
So I see rural service delivery, and there's a question about rural or hard to reach populations. And right now in Brazil, I was part of the working group towards indigenous children in the Amazon. I'm going to the Amazon this Sunday, actually. I'm a very urban person. I lack the skills to go to the Amazon, but I'm going there. Uh, and one of the things is that there's always this idea that we need, PhDs and masters of science and graduate people working on the ground. And in those regions, you have to throw that book out. You don't have access to that with indigenous and rural populations. And
Sure.
if you look at the even the geography of the place, we have cities in the Amazon. There are 4 hours by boat to the nearest municipality. So it is very isolated. So in rural and indigenous locations in Brazil, we are just starting to think about it. And I think this is something that Canada faced in the northern parts of the country. But here our access is very limited. So what we're trying to do is to move the book towards uh, uh, training directed to important people in rural and indigenous locations, and not really care about their diplomas, certificates, and that kind of stuff. Because those regions are not going to have a university anytime soon. They are not going to have the specialized professionals that we need, but they're going to have to get some care at some level. So here we have the whole lack of resources, lack of infrastructure, you name it. So this is one of the points. But if you go to a state like São Paulo, every rural area is like 30 minutes by car to the nearest city. And so it's very easy in that sense to find resources. So I would say to the question, to the rural service delivery that it has here, that it really ups to the geography of the place and the number of professionals that you have available. So I'm going to Rio Branco in Acre, and they have the first family court in the state now. So it's a huge state. It is the size of Portugal. So you're going to have to work in those settings with what you have.
Yeah. If I could jump in just to follow on Sydney's comments, the one that I'd like to comment on is the issue of jurisdiction, because sometimes you find that some entities that need to be a part of the collaborative process commingle what their primary focus is with what other persons are already doing. And so one of the things that certainly can be a key challenge is if you have organizations that overreach. And so they're not necessarily doing what they should be doing alone. And then that injects some confusion in the system. Because, you know, my view certainly is that for the system as a whole to work well and for collaboration to be effective, is that each player needs to be very clear on what their mandate is, what their jurisdiction is, do that very well, and then pass the baton to the next player for them to do very well, sorry, what their core mandate is. And so this issue of jurisdiction, it's something that certainly resonates with me very clearly, because that is a huge part, certainly, of the challenge in our region, in my region, you know, of the Caribbean and specifically Jamaica, where sometimes you have entities that are muddying the waters, and then that introduces some lack of understanding or lack of any clear idea as to who is doing what. And so I think that's a great one that has been picked up on. But generally, no surprises based on what's reflected on the slide.
Perfect, thank you. Botem, you want to go to the next question? I love some of these answers. The trauma-informed training and care.
I love the idea of the digital communication. I think that's great. Leaning into the technology that is often so harmful to our populations of abused children.
And this answer is way more diverse than the first one, because I think that's the whole point, you know, the what is going to be an effective strategy is going to be very cultural, very local. You know, we try to think of systems as they are going to respond to a child, to a family. So this is going to be very there's going to be a lot of diversity in those answers.
Right. I agree. And I love that there were a couple naming child advocacy centers, obviously near and dear to my heart. But the whole idea that we were talking about with the framework that we put up was specifically for regions that don't have the resources for a child advocacy center, either because it's funding or cultural, or because you have disciplines that cannot or won't be involved for whatever reasons. So again, it leans on the different cultural issues and aspects that come up in each different community and region.
Perfect. Botem, you want to go to the next question? and this speaks more specifically to the cultural pieces that you were talking about, Abby and Sydney.
Ignorance. That about sums it up. Some people are still very resistant to being educated on child sexual abuse.
Yeah,
Still that culture of silence and the taboo of the topic,
right.
still so
Mhm.
strong.
That's exactly what I was going to pick up on, the comment here about the taboo nature of CSA. I mean, one of the greatest, I would call it allies of CSA continuing is the culture of silence and the refusal to even recognize it as an issue that needs to be dealt with. Because if you're not identifying it as an issue, it's going to inhibit the creation of a structure and a strategy to deal with it effectively. So that's always a big one. Yeah.
Yeah.
You know, and when we think of Sasha, you know, he fought against all of these things, right? And his courage to come out and tell his story in the face of all of, you know, these cultures of silence, and, you know, even in developed countries, it's still a taboo. It's still, you know, a dirty little secret in many communities and many places.
And here's another one that jumps out about parental conflict. Sometimes you have one parent who is very happy to go through the process of supporting the child and, you know, empowering that disclosure. And then another parent who perhaps isn't so willing because the shame is on their side of the family. And so you have an internal toing and froing that affects, you know, the kind of support and intervention that the child should be getting on a continuous basis. So, yeah.
That's a great point, Diane.
And the political and bipartisan issue is something that we face all the time in every country. You know, this center left, center right. You're always moving in that political scale.
Right.
And we've been trying to actually engage with political agents that are worried about child protection, even if they don't know it, they don't have the knowledge. Many times, political agents, they have zero clue on what is child protection science. So we've been trying, we have our own political opinions, and that is always a hot button in every society at the moment. But what we try to do is to reach out to those that are sensible to the child protection cause in Brazil. And that means working with people from the right wing, from the left wing, that are centrists, because those who are in charge, they should be responsible for that as well. So if we don't engage with them, we're actually giving them a blank check to act upon their actually lack of knowledge on the topic. And then we're going to be complaining and writing editorials of how wrong that is. But I think sometimes we just have to, you know, those people were elected and now we have to deal with that. And that worked pretty well for us during the pandemic, despite everything, because it was not about them. It was about the children that were lacking protection at the time. So I see that this political topic is very important. But here we've been trying to, you know, we have our views, is not the same many times of the ones that are in charge, but we're going to have to do our job, you know, and what is the best thing that we can achieve with that political group?
Well, what I used to say is that child abuse is bipartisan. It's a bipartisan issue. And since then, I've actually had somebody come up and say to me and change my language. It's not a bipartisan issue. It is a nonpartisan issue. It is totally nonpartisan. And we see it made into political football all the time. And it's just not okay.
And it should be the thing that connects us, our desire to
Mhm.
protect our kids and the kids in our
Correct.
community.
Correct.
Well said. All right, Ritam, do you want to? I believe you have one more question, correct? So this one speaks specifically to the film regarding collaboration.
Protecting the abuser. Terrible. But definitely happened there.
jumps out at me is really, Sasha, this stops now, right? Like that's finally breaking the cycle of an interfamilial disease that really affected that family.
Mm-hmm. Not trauma informed for sure.
And then, of course, there's the disjointed response, which was very clear.
Yeah.
Yeah, and the silencing of victims, which is on this as well.
Right.
And of course, the length of the process, which is always the problem with these cases.
Mm-hmm. Silencing the victim and silencing the parents too. If you remember, the pediatrician told the mom, if you report this, they're going to take your child away from you. Don't do that.
Perfect, thank you. Well, now I'd like to just invite our attendees to type any questions that they may have in the Q&A box. We've had a couple come through in chat that I'll try to summarize a little bit. There was this whole conversation, and I think, Sydney, you brought it up, just around when you're forming a collaborative team in remote areas, the lack of certain disciplines, and then who steps in to cover that discipline. I know it came up in our steering committee, Abby, when we were doing the framework about lack of mental health professionals in a lot of places. Sydney, you spoke about pediatricians being scarce and how a general practitioner then plays the role of, someone who may not be specialized on children or forensic interviewing or so. You have three very diverse regions, and then we'd ask our facilitators as well, like what do you do when you lack the discipline? And we talked a little bit about when you lack the cooperation, but what about when a whole piece of the puzzle is missing in an area?
That's what I'm flying to the Amazon to try to discuss with people there, what do we do? So I think especially when you're building from ground zero, that is something that I don't have an answer for that question, Jenny, because maybe next week I will have some insights from the local professionals there. But when you have a lot of diversity, so we have 180 indigenous tribes only in that state. So not the full Amazon, just in a small portion of the Amazon, we have 180 different tribes. So this creates a lot of cultural barriers and a lot of dissonance in what we expect, what they expect, what are the current practices. So one of the things that we are aiming to do is to actually have some sort of moving, and the idea is to use the healthcare system that has boats in the area. So our general idea is to train those healthcare professionals so they're going to do everything. They're going to throw the ball and catch it. They're going to do the both things because there's a lack of professionals. But this is something that they have to be on board. They have a lot of work in a scarce resource area. So I think it's mostly about doing more of this qualitative work, listening to people and getting to know their area. I have zero knowledge of the area, I live in a city that has a human development index similar to Helsinki. It's because Brazil is very, very diverse. So what can I add to that? So I don't know anything about that. So I think we got to have a humble position as well, that we don't know all the answers. I have zero. I'm afraid of spiders and snakes. I don't know why they invited me to that quest, But my idea is, so this is what we do. Would that work for you? So I'm here to learn from you as well. So I think this is an important uh, position that we have to be in. We are not the knowledge guardians. We don't know way more than we should about different cultural practice and how to actually provide care for children in different places.
Well, this trip is going to be amazing. I'm slightly worried about you coming back. I feel like you need to check in with us so we know you made it safe and sound. But it will be interesting, Sydney, again, just hearing the diversity of your three regions as session leaders. And now you're going to a totally different place. So it will be, my guess is the issues are all the same, right? Lack of resources, prevalence of the problem, but then how they go about in those remote areas.
And how many define victim advocate? it won't be something structured. I mean, we have definitions in the US about victim advocates and under accreditation standards, but that may look very different based upon the cultures that you find yourself in, who in that community can advocate on behalf of these children, and perhaps start from there. And I think that's what we try to talk about, is what are the strengths in the community? What is already present there? What do they do that we might, in higher resourced regions, we define mental health as going to this practitioner that you've defined with extra degrees and professional education. And I'm sure that mental health is provided for in very different ways in these communities. What is their definition, and what do they have as resources for their people and for their cultures that might be able to be adapted for the problem?
Yeah, and just as a quick follow-on to support Abby and Sydney, I think just going and being willing in a genuine way to learn is a good way to kickstart the buy-in from the local community, because you don't want them to feel as if you're imposing and doing what you know is best. It has to be, what do you have, as Abby said, and what's best for you because of your local reality. And I think if we approach, all sorts of situations with that kind of mindset, it really lends to the greater success of whatever it is you're trying to implement, because collaboration has to be collaboration in action, showing that we're willing to partner, which means that we value each person's experience and each person's voices.
Well said, Diane. Well said. And then there was a question that came through chat earlier about trust. I think one of you hit on it a little bit in one of your examples about mistrust of whether it's law enforcement or, just maybe a general level of mistrust potentially between some of the collaborative partners. How do you address that, and how is that resolved, or how is it worked around? Or
I mean, I guess from my perspective, it would depend on whether you're talking about one individual, but the discipline is generally safe, or is it a broader problem where the whole discipline is not trusted? And I think it's two different answers. I think if the whole discipline is not trusted, and the other discipline members or the children or the families won't come to the table, if a particular discipline, in some areas law enforcement is what I'm thinking of, comes to mind, won't come, then perhaps you look at how do you form a collaborative response without law enforcement. This is not something in the United States that would or should ever happen, but in different regions, that's not necessarily the case. If it's an individual on a team, for instance, in the US, there are bad apples and bad actors everywhere, then that's where you have strong team communication. And hopefully you and other team members can go to somebody senior to that person and be able to say, look, we're having some issues as a team. This is what we're experiencing, and see if it can be talked out. And sometimes in a worst case scenario, you just have to wait for a team member to turn over and wait them out and keep working around them, which is never ideal, but sometimes has to happen.
We had a rebrand of the police in Brazil in some areas with a specialized unit for intimate partner violence, because many times the police was not called because it was not trusted. But having a specialized unit changed that, and the police was called upon violent acts in higher rates after that. So many times there's nothing much you can do to save that brand, of services. But the rebranding, the police cars have a different logo on their sides. That changed a lot. So it really depends on how did that relationship went as years went by. So that is happening in the south. We call it Patrulha Maria da Penha, and those police cars, they are very welcome in the community because they are trained to not be violent. They are trained to be problem solvers. So the community loves this specialized unit, but they don't love the police cars arriving at a scene. So it really it should be evaluated on this trust issue if there's any chance of salvaging that relationship with the community, or if we should actually engage in a different type of service.
Perfect. Thank you. Diane, anything to add on that or?
No, I think Abby and Sydney have addressed that quite appropriately, and I really just agree with the different perspectives that have been put forward. Thank you.
And then the biggest question that seemed to come out, we're establishing these teams in rural, hard to reach populations. You know, I know we've hit on in pieces, but any one piece of advice that the three of you could give in these really remote areas with.
I would again focus on the strengths. What is present in that community? And depending how remote, again, we have very different regions of the world that we're addressing. Sydney, I don't know that you're going to be able to do anything with internet and connectivity in the Amazon. I've never been there either, so I can't comment. I can only imagine though. But other rural regions, perhaps in the US, could benefit from telemedicine, telehealth, even teleforensic interviews, and teams can be put together in that regard as well with an already established center. So again, I think it depends on the geography and region of where you are.
And one thing that we have here, because I grew up in a urban area, I live in an urban area. This is my first time there. The idea that we have here in Brazil is that you have to be there. You have to go see the place by yourself. In the sense that if you're going to actually give some sort of input to that community, you have to know the community. So there's always this idea that, especially us in the university, we're always saying what you should do or what you should not do. Just giving people tasks and chores, and that's not the idea. You should engage with the people that are actually living in those isolated places. You should know them. You should see how they live, how they engage with each other. And it's very interesting because many times we have this idea that they don't have a comprehension of the urban lifestyle, and that's completely off. There's Starlink in the Amazon, so we have internet access, and they are on Instagram. They found me through LinkedIn. So it's like this crazy, it's a brave new world, but we cannot reach them using our mindset, our beliefs. This is something that Abby said right at the beginning. And I think that's very important. What is important to me in an urban area will probably not hold true for them. So I cannot bring this baggage of knowledge without considering their thoughts about that. So what I think is not important, what they think about what I think is the most important thing in isolated areas.
Well said. Very well said.
Very, very, Sydney.
Yeah, I just wanted to close out with what I think is my final comment, as I have a hard stop or had a hard stop at 11:10. So I'm apologizing from now that I'll have to go off after this. But just to say that I think the immersion in the local community and the local space is really the first step, because it shows respect for their reality, for their institutions, and for the concerns that they have. And then if you involve very key voices from those local communities from the outset in whatever discussions are being had as to the strategy to be pursued and as to the solutions that you're hoping to achieve, I think that shows the local community that you value their input and that it's not a tokenistic intervention that's being imposed upon them, but involving those key voices from the outset and just being willing to learn. What do you have? How can I truly understand what the scope and scale of the problem is so I can know how best to add my own thoughts while at the same time respecting your views. So with that, I'm going to leave it. And it has been fantastic being here.
Thank you,
And I think
Diane.
the rest of the session will go very well.
Thank you, Diane. Thank you for your time and expertise.
Okay.
And at this point, I do know that we are at time. So Abby and Sydney, I'm going to pull up closing slides that are very brief. But if you want to share any key takeaways while I'm pulling this up, I'm sure we would love to hear a closing response from the two of you, if possible.
Yeah, I would just say something I think I've said a few times. It can be done. It seems very daunting. It seems, oh my God, where do we start? How do we do it? It just takes a couple of people with a passion. You don't need a lot of people. Get together, start talking, and brainstorm. That expression, 2 heads are better than 1, 3 heads are better than 1. It will grow. The ripples will grow, and you will be astounded at what you create and the results in your community and for children. And with that, I will leave it, and I'd love to hear from all of you and how your efforts go, please. I would really like that. Thank you all for listening.
So I want to thank Jenny and Karmit and Pragati for giving us this opportunity. And I think in low and middle income countries, the whole thing for me is it's one of my favorite poems by Antonio Maceo. That is, El camino se hace al caminar. The the path is made by walking the path. You know, you don't know where you're going to get, so you're just going to build block by block. That's the whole point in our communities. So I think that's the key message for us in low and middle income countries.
Perfect. Thank you. Thanks to both of you. And now just a few brief closing slides. We just wanted to always take a moment at the end of a session to thank Sasha, right? This is based on his journey, his story, his real life childhood, and for him to courageously share his story through this film and to allow us to use the film to develop the HUDDLE curriculum. It's just, we are eternally grateful for him. And then thank you to Abby and Sydney and Diane. The information you presented was extraordinary. We appreciate your insights again. All the work you've done in forming collaborative teams in your regions, in your area, and you're willing to share the challenges and the successes, and that it is possible. I think the message of hope that you've all shared, regardless of the situations within a certain community, that there is hope and there is possibility to provide a collaborative response to child sexual abuse. And to our facilitators, Pragati, Antonio, Kathy, and Sarah, thank you so much. To our amazing team at Haru, we've had just the best experience, and we had an incredible group online today. You'll see their names on the screen. So again, our heartfelt thank you to the Haru team. And next week, I just want to speak to session 5, is where we really explore through Sasha and Pablo the resilience. So despite of it all, where does a child go, you know, after their journey and after their how do they take their pain and make it a positive thing? And how do they learn resiliency and move on and have a productive and happy life? And Sasha's a great example. And he will be joining us in person with Pablo next week. So again, if you have not signed up for session 5, just hit the ISPCAN website and there's a unique link to register for that session. And just finally, we'd love your feedback. There's a Zoom poll that pops up as soon as you disconnect. There's a few questions. We read them every week. We share them with the facilitators, and we adapt the following week's sessions. And this huddle will be a yearly event, so we're really looking for your feedback. If you could take just, 5 minutes to complete that survey after you disconnect. I know we ran long. Thank you so much to our audience members for staying with us. It looks like really most of you stayed, so hopefully you gained some great insight and knowledge. And again, Abby and Sydney, thank you so much. And safe travels, Sydney. I'm a little worried about you. So we'll have to bring you back and actually hear about your Amazon experience. I think that would be a great part too to this conversation. So, and good day and good night to all who joined us. And again, we appreciate you spending time with us. Bye, everyone.